We are live right now. Just waiting for a few more members to come on. Mike will be a few minutes late. He sent the message this afternoon. Donna will be unable to attend tonight.
Maureen, she's muted. Michelle's on, but not with video. Steve.
Okay, thank you.
All right.
I heard you, Cindy. I was going through the links to get everything set up for you guys to be linked to the Wyckoff website. So you're live.
Wait, I'm waiting for Casey. Says he's on, but I don't see him. Do you see him at all, Maureen?
I do not. Let me see.
He originally came on with Maureen's name. I think he's the other Maureen Mitchell.
Okay, let me. Why do I not see him?
I see two Maureen Mitchell.
Okay. Let me take care of that. Rename.
Okay, let me do that.
If somebody's watching it on another device, you have to mute your YouTube, please. Casey.
Somebody's watching on another.
Technology's great, isn't it?
Yeah, mute your YouTube if you have your phone or another device other than the Zoom thing going. All right, you guys you're live, you're all set. Unless you want to wait for other people, that's fine.
Want to see if Casey has video, or he's just going to be on audio then?
I don't know how he logged in.
Okay.
Casey?
I don't know how he logged in.
Somebody,
Okay, well, we're getting some feedback there, as you can hear, Maureen.
yeah, somebody's listening on a second device because the YouTube feed is on a delay.
Yeah.
Yeah, some on
Yeah.
a second device.
Yeah, so don't listen on your cell phone and watch it on your PC.
Feed
You have
is
to do
on a
one
delay.
device and watch it on your PC. You have to do one device.
Let me see if I can do something about this.
Let me see if
There he is. There he is. Now there's a big delay, Maureen, in audio.
Yeah, I mean, is anybody?
yeah.
Is
Like the
anyone,
connection is really bad.
Is anybody?
is anyone on Zoom also watching the YouTube live feed on their phone or another device? Because if you are, you need to mute that second device, mute the YouTube feed. You have to just be on the Zoom meeting without a secondary device to watch the YouTube feed, because that's what's going to cause that delay. Now oh, there's Dr. Clark. All right, can you guys hear me? All right, so why don't you, Dr. Clark,
Okay.
start your meeting and see how
Never a dull moment. Thank you, Maureen. Well, welcome everybody. This is the Wyckoff Board of Health monthly meeting. It is May 13th, 2021. Madam Secretary, would you like to start the meeting with the official announcements? You're on mute.
I'm going to take attendance first.
Fantastic.
Dr. Yee. He's here.
He's connecting. He's on.
Yeah. Dr. Clark.
Here.
Devalina Sen. Donna.
here.
Donna isn't here.
Unable to attend.
Okay. Mike, I think, is coming late. Mike Sparazic.
Yes.
Lindsay Nasso.
Here.
Pete Melfione. I didn't hear from Pete.
Yeah, he may be with the Memorial.
I'm here, by the way. Cindy, I'm here.
Okay.
He's
Devalina, if you
culinary.
can, excuse me, Cindy. Devalina, if you can mute yours. Perfect.
I've got Linda.
Sorry.
Linda, I think is frozen. Are you frozen? No?
And who?
Michelle is on the phone.
Okay.
And me. Okay.
Fantastic. We start every meeting with the Pledge of Allegiance. So, Maureen, can you give us the flag if you don't mind, please?
Okay.
Fantastic. We start every meeting with the Pledge of Allegiance. So, Maureen, can you give us the flag if you don't mind, please? There we go. I pledge allegiance
To
to the flag
Of the United
United States of America,
and to the
to the
republic
republic for which it
stands
stands,
one nation
nation,
under
under
God,
God, with liberty
indivisible, with liberty and justice
for
for
all.
all.
Okay, please take notice. Please take notice that in accordance with the Open Public Meetings Act, NJSA 10:4-6, and in consideration of Executive Order Number 103, issued by Governor Murphy on March 9th, 2020, declaring a state of emergency in the state of New Jersey, the Board of Health of the Township of Wyckoff does hereby notify the public that to protect the health, safety, and welfare of our citizens, the meeting of the Board of Health of the Township of Wyckoff, scheduled for Thursday, May 13th, 2021, will be conducted virtually through the Zoom video conferencing application, and it will be live streamed on the Township of Wyckoff's YouTube channel. The work session is scheduled for 7:30, and the public business meeting will begin at 8 p.m. These measures are implemented to allow members of the public to observe the meeting via live streaming and to provide the ability to comment during the periods for public comment during the meeting through Zoom telephone call-in technology. Joining the meeting by telephone will be utilized as a security against the sharing of inappropriate video content. General instructions regarding access to the meeting is posted on the Wyckoff website's homepage at www.wyckoff-nj.com as a news item. This regular work session meeting of the Wyckoff Board of Health is now in session. In accordance with the Open Public Meetings Act, notice of this meeting appears on our annual schedule of meetings. A copy of said annual schedule has been posted on the bulletin board in Memorial Town Hall. A copy has been filed with the municipal clerk, the Record, the Ridgewood News, and the North Jersey Herald and News, all newspapers having general circulation throughout the Township of Wyckoff. at least 48 hours prior to this meeting. The agenda thereof was similarly posted, filed, and mailed to said newspapers. Formal action may be taken at this meeting.
Fantastic. Thank you, Cindy. Thank you.
You're welcome.
This is the work session, and what happens is we go through just some various things that go on with the community that impacts health. At this time, we ask any members of the public if they had any comment. They were to ask comments by yesterday, but we're happy to take comments. We limit it to 5 minutes per speaker, so we can let anybody who would like to speak, speak. So at this time, I'm opening up the floor. If anyone has any comments from the general public, please speak now.
So Dr. Clark, there is an attendee with a phone number 201-470-8915.
Right.
I don't know.
That may be
I-
Michelle.
Is Michelle, unmute yourself. Is that Michelle?
yes,
201-470-8915?
That's Michelle. That's Michelle, our liaison with Bergen County. Yes.
Okay.
Okay, so great. And welcome, Michelle, of course. Seeing that there are no public members that are asking any comments, we're going to close that portion of the meeting. What we're going to do is we're going to start working very slowly and start going to our regular business. At 8 o'clock, we have a guest speaker coming, and I hope you'll indulge me that I may move around the agenda a little bit, just so we can make sure that the speaker can get on and preserve everybody's time accordingly. So what I would like you to do is we can go right into the approval of the minutes for the March 11th and the April 1st, 2021 meetings. So you should have had those already. I'm just going to move this over. Okay,
Yep.
so let's start with the March 11th meeting of 2021. Are there any questions, any comments, any additions, any deletions on there?
No.
Does anybody have any problems with that? Then I'll entertain a motion to accept that.
I'll motion.
Motion by Lynn, thank you. Is there a second on that? Linda, there's a second, thank you. Any discussion on that motion at all? No discussion, all in favor, say aye. Aye.
Aye.
Any opposed? Any abstentions? The ayes have it. Thank you very much. We'll move right to the April 1st meeting. That's April 1st, 2021. You should have the minutes there. Anybody have any comments, additions, deletions to that? Anybody see anything on there that needs to be modified? And
No.
Cindy, again, thank you for the notes. They're excellent minutes. Where all of us are on different organizations, just from personal experience, I can tell you these are excellent. And so anybody have any comments, additions, deletions on the April 1st, 2021 meeting? Okay, I'd entertain a motion to accept those minutes.
I'll motion, Steve.
Okay, thank you, Lynn. There's a motion first by Lynn. Is there a second? Linda seconds it. Any discussion on that motion at all? Any discussion? Seeing no discussion, all in favor say aye or raise your hand. Any opposition or any abstentions? The ayes have it. That motion carries. Those minutes all are approved. Thank you very much. I've got a lot of things all over the place, but of course, you know, it's still 24/7 COVID, but there's still a lot of other good things going on, as everybody knows. I'll start off with the good news with me. I got my second vaccine last week, only 11 weeks after I initially registered at the Meadowlands. So I think that's pretty good. This time last Thursday, I walked right up, walked right in, sat down, registered, shot, and boom, out the door. Fine for the first 24 hours. Second 24 hours, not so great. So I want to talk to the public also too, is that now that people have their vaccine cards, we're starting to hear situations and stories of people losing their vaccination cards and in a panic. What do I do? You know, and so there is a site, and I want to put this out there, that's called the New Jersey Immunization Information System, NJIIS. And you can just go online, you can submit a request. You have to show some type of ID, and what they'll do is they're saying within 48 hours by mail, they'll send you a replacement. And so I would assume not 48 hours. They're saying 48. I would think it'd probably be a bit longer than that, just because there's really very few people in Trenton right now working, although they're starting to come back, as everybody knows. So that's a good thing. That's a good thing. Domestic travel, no quarantines. So that's a good thing. Today, there's been a lot of hubbub of a lot of different things going on. Outdoor gatherings still must be limited, but and still social distance. So now they're talking about you can have 100% attendance, but I'm not really sure how you do the 6 feet social distancing if you have 100 attendance. 100, so let's say your restaurant and you have 50 seats. How do you socially distance that, but yet you're allowed to have the 100% of people there? So there's still things that still really need to be worked out there. The state is saying if there are no unexpected upticks in COVID-19 on Wednesday, 5/19, outdoor gatherings will be, any limitation on that will be completely lifted. And today they talked about that, lifting it ahead of time. Entertainment centers are still around 500 people, but they're talking about maybe increasing that as well. The outdoor limits now are lifted. You don't need to wear a mask outside. You really pretty much can go back to what you were doing without a mask, unless you're in certain professions, and we'll talk about that. Large venues with fixed seats, maximum of 1,000 or more, they may host at a 50%, but that's changing. Just about every hour it seems to be changing. Let's talk about last month. I spoke to you and I mentioned in New Jersey there were 4.87 million people who were vaccinated. Right now, there are 100. Last count is I got that wrong. Last month there were 1.6 million. This month there are 4.87 New Jersey residents. So in 1 month, 3 million people got vaccinated. In New Jersey, there are 4.87 million people, or 50% of the state has been 54% of the state is vaccinated at least 1 dose. So that's pretty good. 3.7 million, or 42%, have had the full vaccination. So we've got almost about half of the state is fully vaccinated. And that's a pretty good thing. That's a pretty good thing. No masks, but that does not apply to airplanes, buses, trains, or any type of public transportation or healthcare settings. So that's a challenge right now, is healthcare settings, depends on your healthcare setting. So, but that's going on. I wanted to bring Devalina back. I don't know if you're there, Devalina, still. There's some things going on that we should just be aware of to see. India, Devalina has a lot of family in India, and there's a lot of situations. Everybody knows what's going on, how bad it is over there. But I'm reading also, and we should just be on alert that the COVID vaccine now, one of the big things a year ago, everybody was put on a ventilator. Then they realized that steroids were probably a better way to go, and they started doing that, and a whole triad of medications. Well, in India, they're starting to find that people are developing what's called a black fungus there, and it has to do with the overuse of the steroids. So one thing may help one thing, but on the other side, the pendulum swings and may cause problems there. They believe it's in the sinuses, it's in the lungs. You would think black fungus might be decay of tissues such as diabetes or something like that, but it comes from the overuse of the steroids. And maybe they're lowering the immune system or somehow compromising the body. That's where the problems are coming into. So I don't know if Devalina, are you still there? And if not, we can come back to that. No? Okay. The deaths are down.
No, right here.
Lower your volume first, just a little bit. We may have a problem hearing you, Devalina. There's a lot of feedback and static, but let's try. So you have to come off of mute.
Can you hear me now?
Yeah, just lower your volume and that would be awesome.
Okay, is it better?
It is better. Still lower a little more. That'd be great.
Any better?
You're getting there. Still loud, everybody?
Okay, then I can't hear much, but okay, I'll try.
Okay.
Is it better? Shall I switch the computer?
You know what we're going to do? We'll talk about it maybe next month or later.
I can switch the computer.
Yeah, it's very staticky, it's very loud, and it's very difficult to hear. So, maybe you go back on mute, that'll be fine. And we'll come back to that. Okay. That's what I have here. The schools have done very well. I just got a text just a little while ago from the superintendent of schools here, Kerry Posma, who said that everything is going very well in the schools. We had 1 case last week and none so far this week. And boy, that is a dramatic shift from what we've been hearing a month, 2 months, 6 months ago. So that's that's good news. I think people are doing their thing. I think people, with the vaccinations is making a big difference. I think it really is. And the people are still smart. I think they're, Wyckoff especially, people are really doing the right thing. The restaurants have been very good, very good. I've been going around, you can see they're doing very well. They're still using gloves, they're still using masks appropriately, and that's what we want to hear. We want that. We want the public to know that the restaurants and the people that are handling the food are doing the right thing. And if they have questions, they are calling the Board of Health, and that's a good thing as well. So that is my report right now. Does anybody have any comments, anything out there that you hear going on? Lynn, if you wouldn't mind, bring us up to date. What's going on in the hospital system right now? Because you're right there. And then Dr. Yee will talk about grassroots at, in the local doctor's office, but you're in the hospital setting. What's happening?
Definitely a major trend down in numbers, completely. My admissions, I want to say to date, it's the 13th. So probably out of 120 admissions I have to date, I think I have one, if not two, COVID positive admissions. So that's a tremendous decrease in numbers. So I think that, people are being vaccinated. I was interested to see former Mayor Shanley post numbers about Wyckoff population vaccination. Did anybody happen to see those numbers about the percentages of, our own community and how many are vaccinated? I thought they were great numbers, and we're 10% ahead of, I guess, the average in the state of New Jersey.
Yeah. And I read today that New Jersey still has about 4 million doses of vaccine. They have it in hand that they can give. They just need to get the bodies there. And you're starting to hear of different centers, vaccination centers starting to close down. Now, as I mentioned once before, you can probably go to a 7-Eleven and get a coffee, a paper, and a shot. It's going to be that easy. And it's getting that way where, like I said, last week, I walked right into the Meadowlands. Nothing impeded my flow all the way to the beginning to the end. I was out in 25 minutes. So that's a good thing. Lynn, you had mentioned a story. You had talked to me about there was an interesting case that of an individual who had MS and then had the vaccination, then had COVID. We're hearing some stories now. You're hearing about the New York Yankees right now, that they had some trainers.
Yeah, I think that
like
there's
that.
question if they had an autoimmune history, and there's question of if the vaccine is effective in people that are taking medications for autoimmune disorders. So they were vaccinated, 2-dose vaccines in February, and ended up being admitted with, and so it's interesting to see. I think we're seeing a lot of different unique challenges with those that have been vaccinated.
How about antibodies? Anything with that, lady? Lynn? I think Lynn is frozen, so.
Well, I think we were all thinking the 3 to 6 month rule. Eventually, I read something about 6 months is what they're declaring. But I can tell you people have retested for antibodies in that 3 to 4 month mark that are now testing negative. So I'm not convinced that the antibodies are lasting that 6 month duration. Dr. Yee, what are you seeing on your end? Because you're also hospital affiliated.
Oh, I haven't been testing too many people for antibodies. I just don't find that I didn't really think that was going to be useful information to determine whether you're still immune. I think that there's some talk about also cellular immunity that probably remains in the system. So, even though antibodies may not be positive, that there is probably still some immunity. Your body probably still recognizes the viruses. So hopefully that's the case. And I guess I'm not sure how they're going to determine when we would wind up getting revaccinated. I guess is that the plan if we find that a large amount of people are not going to have antibodies, that they're going to want to be vaccinated like the flu vaccine, I guess.
I think that, those that are vaccinated and, if it comes down the line where a booster is required, I think people are going to want to start to mark their antibodies to see whether they're still
Right.
new or not before they go ahead and get a booster. So I'm hearing a lot of nurses using that as a beginning marker.
Mhm.
And I don't know the answers. Does
We'll
anybody
see.
understand why the antibodies trail off? We had measles when we were a kid, and we had immunity for many, many years, or chickenpox. Why is it such a short-term thing? If it is short-term, I'm not sure. I think there are other people that have it long-term as well.
Well, what I
Well,
read
trail
about
off.
it, oh, sorry, go ahead.
Sorry.
Go ahead, Develina.
What I read about it so far is just because it's the nature of coronavirus itself. And even though it's, another mRNA, but it's just all other coronaviruses, which are not as fatal as this one, has been that way. It's just a very short-term thing. Every year you get sick with some or the other coronavirus. So it's pretty much, that's what, the last thing I read, that's what it is. And I also read about the cellular immunity situation. And also it will depend a lot on the person's in general health, innate immunity, and food and microbiome and all those little things here and there. Like in our family, people, those who got vaccinated in February and are autoimmune, are on immunomodulators, same problem. Their antibodies are pretty weak. My mom-in-law, my aunt, they got tested. They both have autoimmune disorders, and it's just their rheumatologist said, well, it's showing pretty low immunity. But at the same time, my mom-in-law works at the COVID unit in ICU. It's not like she has not been affected yet. So it's kind of hard to say. It's kind of hard to say. On the other hand, I heard about another person, same thing, on immunomodulators, has autoimmune disorder, before vaccination tested positive for antibodies, which was very weird. I guess he tested falsely positive. But these antibody testings are still not as good, honestly. That's one thing I keep reading about, that it's not as sensitive as we thought it is.
Thank you.
Thank you, Develina.
Develina, if you don't mind too, we have a great connection. Can you talk a little bit what's going on in India? Because you've got direct connections there, and you're hearing things on the ground there.
So I, other than general public and a few family members I spoke with my friend in the ICMR, which is the Indian Council of Medical Research. So what basically happened there is just they thought they fended it off very, very nicely. So in Jan and Feb, they had almost no cases in the rural areas, and big cities had cases, but it wasn't affecting anyone. So the government did take off the mask mandate from everywhere, and they also started running the public commuter, like the train. India has a huge railway system, like daily commuter railway system, buses everywhere. They started the full capacity, 75% to full capacity, and people were not wearing masks. And they also started attending weddings and everything. And in India, the weddings are not 150 people, it's usually 700 to 1,000 people. So that's where the super spreader event started, and that's how it just flared up. The only problem was they didn't vaccinate enough. They were into just about 1% fully vaccinated when they thought they have innate immunity and it will be fine. So it's a shame that India has two giant facilities where pretty much all the vaccines of the world gets from, and they didn't do their part, and the government didn't do their part. It's just a poor infrastructure. And to me, I haven't lived there in the past 18 years, but what I see and feel is just a poor infrastructure. They didn't roll out the vaccines. They didn't have the plans in hand. And they were basically just living on, I would say, prayers and how it will go with their innate immunity. And it didn't work out. The super spreader events were all over the place.
hopefully we'll start seeing them getting a hold of that and start bringing those numbers down again. You know, unfortunately, there's going to be a lot of heartache there because it's just the numbers are overwhelming.
Yeah, it is terrible. They don't have enough oxygen supplies. It's extremely hot, and to wear PPEs, the physicians are getting dehydrated, and it is very, very difficult with 1.4 billion of people. And I mean, the cities have good system infrastructure, but rural areas, suburban areas, is very poor system for to fend off a pandemic like that. And they expected that. And that's why last year they closed down early. They did very well last year, but I guess they didn't expect the second wave, which is, to me, is not very wise.
All right, good. Thank you. Thank you so much. Well, right on the button, as I asked earlier, I'd like to move the agenda around a little bit because our guest speaker has come on. And Noreen, I want to welcome you. Dr. Moley is a PhD in psychology, and I had talked to her about bringing her knowledge to the Board of Health of the psychological impact of COVID and how it's impacting families and maybe kids and what's going on. She spent 30 years in the public school system as an educator. She's private practice in Ridgewood. She's worked and trained community mental health issues in different health settings in Pascack Valley for over 10 years. And she currently is on the executive board of the Northeast Counties Association of Psychologists for the past 6 years. So Doctor, I welcome you. You're on mute right now. So you got to click that little button on the bottom bar there. On the bottom of the black screen, you might see there, it'll say mute or unmute. Mine is over towards the left side.
Unmute.
Perfect.
Can you hear me?
Perfect. We
Can you
hear
hear
you loud and clear. And
Okay,
thank you so much for coming on board with the Wyckoff Board of Health to give us some information of what's happening and how you're handling and what's going on throughout the state with the psychological aspects of COVID. So, Noreen, thank you again for your time, and the floor is yours, of course.
Okay, thank you. It's nice to meet you all. I'm happy to have the opportunity to talk to you about mental health and the COVID-19 pandemic. I want to give you my general perspective on mental health in our area before the pandemic, during the pandemic, part one, that's before vaccines became available, and part two, now that vaccines are available. I'll also give you two examples of family situations that highlight just some of the needs in our communities. So firstly, life before March 13th, 2021, the date Bergen County announced that all schools would be closed. At that time, people in our communities were being diagnosed with anxiety and depression. Many other people were suffering in silence with undiagnosed anxiety and depression and other maladies. Physicians and other healthcare providers in our area were routinely doing depression and alcohol screenings for patients and following up in some way based on concerning data the patients were providing. These problems tended to be underreported at that time, before the pandemic. Domestic violence was also underreported. In addition, families were in crisis with substance use disorder, and more treatment centers were opening in our area. There was some destigmatization of mental health disorders. There was financial stress for many, and we were all living increasingly fast-paced lives. Then enter part one of the pandemic, March 13th in Bergen County. That date marked a sudden halt to life as we knew it. What rose up was fear, uncertainty, isolation, loss of structure, routine, and the real loss of lives and jobs. There was high stress, more intense depression and anxiety for those who had these issues earlier. Now there was a much greater need for mental health care. We were all feeling the effects of this seismic shift to life as we knew it. As families were forced together in isolation, or people alone in isolation, there was a surge in the intensity of frustration for many. More threat of domestic violence, addiction and relapse, and suicidal risk. Parents who could still work had to juggle childcare and school online with their work responsibilities. Many had responsibilities to their elderly parents as well. There was fear of contracting COVID-19 as we were learning more about how it is transmitted and how it affects the human body. Mental health care was becoming accepted as care that was smart to access if you could get it. Providers were and are, for the most part, fully booked and were and are referring to all the solid resources we can find that are out there. We as a society were and are becoming aware of the many cracks in our systems, such as in healthcare, education, in business structures, to name a few. Now our part 2 of the pandemic. With vaccines readily available, people are making their personal decisions as to how they're going to proceed. Vaccine or no vaccine. Look for a job or wait till unemployment runs out. Send my child to school or not? Is it safe to visit with family and friends? To get on an airplane? And perhaps we're adjusting to the loss of loved ones or jobs, and definitely figuring out how to restart our lives. It will certainly be different going forward. Now we're tasked with accepting reality, determining what we can change and what we can't, reassessing priorities, and hopefully putting physical and mental health higher on the list. These are some of the internal processes that are needed and challenges we now face. So here are some of the needs that are out there now that I have personally encountered, and there are many, many more stories to tell. For one, there are families who have young adults who were suffering with mental health issues before the pandemic, who were barely getting by before it hit. Maybe there was school, maybe there was a part-time job that helped them hold it all together. Some parents in such situations can feel paralyzed by fear and shame, and they tend not to seriously pursue and insist upon mental health care services for that young person under their roof who may be inflicting psychological abuse upon them. How can community resources become available to support these families? And what would these resources look like? Another example is the elderly who have, out of fear, not gone to their physicians and have been dealing with chronic pain, and may also be caring for a partner who has cognitive impairment. What resources can be made available to them? Now I'm posing these questions with the personal hope that more coordination can be created between and among health resource providers within our communities, as the pandemic has made these needs and many more so much more urgent. So that's my perspective on what's happened and what is happening now. And at this point, I want to know if anybody has any questions about the resources, any of the resources I have sent in advance.
Well, can you talk a little bit, thank you, Noreen. Can you talk a little bit about Mental Health Awareness Month and some of the things that your organization is doing this month to promote mental health? Wyckoff is a stigma-free town, as many towns are, but Wyckoff is very proud to be stigma-free, and we've worked hard, the schools have worked hard, and the township has worked hard to promote that. So can you tell a little bit about it?
Okay, so at the state level, I want to say that the New Jersey Psychological Association has had a campaign for awareness about mental health, and they had a contest about showing the how people are coping positively with the mental health issues over the course of these past months. And they recently had a winner of that contest, and it's on at the website, website for the New Jersey Psychological Association. And I have to say that New Jersey Psychological Association, which is the state association, and Northeast Counties Association is their affiliate. And we serve, our local affiliate serves 3 counties, Bergen, Hudson, and Passaic. But at the state level, NJPA is doing its best to make the public aware of mental health needs throughout the year, not just during May. And they've been promoting different activities since COVID started, and they've been reaching out to us, the psychologists who are its members, and letting us know about every initiative that the state has taken to help the public, protect the public. For example, one of the things they did was advocate to the governor with regard to healthcare insurance companies to waive copays, to waive the upfront costs of healthcare, and that's been ongoing. And so they've rallied for the state. They've also let us know about every of the most current updates on COVID-19, what's been happening at the state level with the CDC, and how different ways to function as practitioners so that we could provide telehealth, which is NJPA is going to be advocating for to continue beyond the state emergency.
Noreen, I had a quick
yes.
question.
Yes.
Hi, my name's Casey Collinari. I was just wondering, I'm sure our representative, Dawn, is not here from the high school, but she is the school nurse at Rampo. Oh, no,
Yes.
Indian Hills. And I'm sure you're seeing, with this past year, but I'm sure there's going to be a big backlog of, issues that students are having with, parents have lost their jobs, they've been displaced, there's just been a lot of incidents and now the next phase is, they're looking, I see it as who's going to get vaccinated and not vaccinated. And once it comes down, we're not sure, right, Doc, if it's going to be mandatory. I don't believe they'll make it in the schools mandatory. I could be wrong, but then you're going to have that discrimination. Well, I'm vaccinated, you're not vaccinated, you can't be around us, you can be around us. I think that's going to be an issue, I think, with mental health in the teenagers, big time.
Absolutely, absolutely. And as of now, the schools are not discriminating about who's coming back to school, whether they're vaccinated or not. That's been a statement that was recently made in the state of New York. So I'm guessing that New Jersey is going to do the same. So it's going to be a challenge to respect the civil rights of these families to make a personal decision as to whether or not they're going to be vaccinated. However, we know that certain immunizations are part of school entry in general. And it may come to the point where, based on data, it's going to be determined that for the safety of all, people will need to be vaccinated. But that's probably going to come to us as a result of more research that is ongoing about, public health safety for, the communities. So that's going to be a difficulty, and it's going to be a challenge for families and teachers and school personnel to model respecting personal decisions until that point at which it may become mandated. Does anybody have any? I would like to hear if any of the the people who work in public, nurses and doctors have any viewpoints on that. Do you have any viewpoints on
Hi,
that?
Noreen.
Yeah.
My name is Lynn Spreen. I'm a registered nurse, and my background in nursing is actually behavioral health. Not so much on the viewpoint of vaccine, but I'm a nursing care coordinator, so I work with primary care physicians affiliated with a hospital base, but I work with patients within the community. And I would like to be positive to say that I feel that during this past year that there was more access to mental health services for adults and children. More access, I mean, because of the state approving the telehealth, right, during the state of new, so it regardless of, location or where a patient lives, they were really able to get the continuity and the access via telehealth, where being able to physically get their child, into the office. The only thing I do find is that there's such still a delay in care. I'm not sure how you, as a healthcare professional, is really able to handle. And I called
You're breaking up a little bit, Lynn.
adolescent child to seek help. And I'm told as of today that basically people they have available appointments starting in September. There's no crisis access really immediately available. It's a definite barrier to care. And I'm sure you just saw such a huge influx this past year with mental health situations.
Yeah,
So-
I'm going to say that to echo your point about the availability of telehealth has brought in so many people between the ages of 18 and 30 who are have a lot of facility with technology. They are able to keep their jobs working from home. They were able to find a point in their day that they could make an appointment with their practitioner. I have many new patients who came on as a result of the availability of telehealth.
Right, absolutely agree. Yeah.
Yeah, and they were saying because of this, I guess I consider it also when our society paused and they started to think about their own needs, when everything slowed down and came to a stop, and they were seeing their own anxiety and stress building, they really used the resource of telehealth, and they're making really great progress. So that's a positive. And at the same time, there's still these needs out there. And I am hoping that some of the local monies that are coming from the federal government to our state and our communities there can be some more planning around some of the things that I think are needed are the definite support groups for the elderly who have been isolated, who may have in their homes, they may have their own cognitive abilities, but they are caring for people who, their loved ones who have cognitive impairment, for example, and people really seem to really thrive when they're in these support groups. That's one thing. The second thing is how the police department can work with families that are suffering from psychological domestic abuse, or that there's that risk of being developed into physical abuse domestically between people who have mental health issues and their family members. And so what some of the things that I'm working with people are on how to build healthy boundaries between themselves and their loved ones and reach out for help to even a presence in the police department, for example, who could say, okay, I'm going to come out with a social worker and look at your situation, and maybe we can influence this person to begin to start a mental health treatment and help the family develop these healthy boundaries that they need to have with people who have living at home without care and are really inflicting a tremendous amount of stress on their family members.
Dr.
I
Yee,
agree.
Great.
I mean, I think the direction I was going in is that I would love to see our long-term goal for mental health access to be more immediate than if and when in crisis, you know, to have to refer patients to the emergency room.
Oh,
I wish there wasn't a 3-month wait for appointments and you know, let's hope that that can change with the access to telehealth in the future.
Mhm, mhm. So what is now, I've seen out there, I have my colleagues and I, through our affiliate, we've had a lot of activity in Zooms with each other to share resources with each other, to talk about our own stresses in providing care. And to answer your question, Steve, about how we're celebrating Mental Health Month. Again, because of all the need out there, we started acting early in our affiliate and providing educators an educators forum. And we got educators together to talk about what they're dealing with in schools and their stresses, and these people coming on screen and talking about their strategies that they use, how they're personally coping, and also resources that they know about. So that's been helpful, we think, to the community as well. And so the other things we're doing is we're really trying to reach out and let people know about our association through our flyer. And we're going to be, during the month, continuing to try to get press releases out there just with mental health information.
Dr. Yee, you're a primary care practitioner. Are you seeing any type of mental health issues? I mean, we know that health is physical and mental and chemical. And...
Yeah, we definitely are seeing a lot of. I'm seeing actually. I have a very large Medicaid HMO population, and you know, in Englewood, Vantage Health System is. Yeah, in Englewood. Vantage Health System is the only resource as to some of this patient population, and getting access to for this population is very difficult. They often are telling me that it's 3 or 4 months into the future before they can get an appointment. So they come to me for primary care as a primary care physician as a crutch. And I think that as great as telehealth is, I think that it is missing a personal touch kind of connection that patients are not feeling. I mean, I see also on the other side is that because I also work in the pediatric ER, I think that people coming in because they just feel like therapy through telehealth, especially psych therapy, is not how the kids are used to seeing it. They like being in person. They like they're missing some visual cues.
Yes,
I think that, and so I think that I just get the sense that there's certain barriers that telehealth is not providing, and I don't know why. I mean, I don't know why, for example, an organization like Vantage Health System is not providing more telehealth services. I'm not seeing that my patients are getting access to psychiatric services as much as much as I would like them to, and they want to go into the ER. And then even for the adults, I wound up having to prescribe. You know, I'm comfortable with assessing basic anxiety, depression, and treating them. And certainly, I am glad that I don't see a whole lot of the more complicated depressions with hallucinations and with psychosis in the office. But yeah, I think that there's still a lot of stumbling and barriers. Even telehealth for general medicine. I mean, I've been seeing patients throughout the entire pandemic, and we haven't stopped. And I think my telehealth visits are probably in the range of maybe 2% maybe less than 5%. And people like coming to the office. And certainly with primary care, with vaccinations, they can't do telehealth and get vaccines at the same time. You know, so.
Thank you very much.
Real quick, I just wanted to say I read an article. It was in I can't think of the name, what article, but it was talking about how depression. A lot of people think that younger, older. Some people depression has an age, but they're finding that with the and maybe you can correlate this, doctor, that this is the first time with the pandemic of this magnitude that's being able to be tracked, that where people were separated for such long periods of time, that depression really, they hit them and they didn't even know they were depressed, and they couldn't, they weren't able to go to the doctor and get the help they needed, and it really spiraled, and a lot of people unfortunately did take their lives, and a lot of addiction and abuse, substance abuse did occur.
Yeah. Noreen, you're on mute.
You're asking a question about the onset of depression?
Yeah. So my point was, have you seen in the, because we've had Dr. Stephen Clark had brought in people from the where a lot of the elder community, especially in Wyckoff, would go, and they have a lot, they say their loved ones passed away. They would meet at the daycare facilities, and they had a lot more interaction. And when the pandemic happened, they didn't have that access and that group therapy that everyone needs. And a lot of people have their families when you're younger, but as you get older and you don't have your significant other, and you don't have those groups that you socialize with, that a lot of the elder community has become depressed.
Yes, absolutely. And because they don't have, they're not the facility to use technology or the comfort with technology, they've been cut off. And so, at this moment, with more availability of the vaccine, more people are feeling a little safer to go out. These older people that you're talking about, they're actually starting to have their first experiences in the supermarket. They're talking about, and they're saying, okay, I went to the supermarket for the first time. And another point that I want to make is that, and I want to answer your question as well about depression in general, is that not everybody is going to be moving forward at the same pace. Some people are out on planes, as we know, and traveling to different parts of the country, and some people are stepping out of their houses for the first time to go to the store. So it's really varied, and I hope that people are just going to respect each other's pace, because we're all at our own pace at what feels safe to us. And depression can hit at any age, and even very young children can be genetically predisposed to depression. And depending on the amount of stress in their lives and trauma that they experience, depression can happen at any age. And people, we used to use the term burnout, and burnout was just stuffing everything and not processing anything and just being on the go. And then all of a sudden we are stopped in our tracks by a loss of energy, exhaustion, even the beginning of physical symptoms. And these are indications that we could be suffering from depression. So our attention to our emotions, our attention to experiences that are troubling, and having a way to process and sort them out with someone else. These are very, very important when we don't have access to mental health care. The messages that we were receiving throughout the pandemic: reach out to someone, remember your neighbor next door, simple things like that, making any kind of connections to someone can be better than isolation.
Right, very
Is
good.
better than isolation.
Very good. I want to respect the doctor's time and the board. We still have an agenda. Does anybody has any last questions before we wrap up her presentation and give her a chance to go on with her evening as well? Anybody have any questions at all? Okay.
Just want to
Okay,
say
if you
thank you.
find that you have anything you want to reach out about, you have my email, and either myself or anybody in my association who could answer the question, I will, pass on any question that I can't answer to somebody else so I can provide you with something. And thank you again for the opportunity to be here.
Great. Well, thank you. And thank you for sharing your expertise with the board and your experiences. And I think it's been helpful and we really appreciate your time. So thank you so much.
Okay, take
All
care.
right. You have a great evening and we're going to go on with our meeting, finish it up. So thank you so much.
Okay, thank you. Bye-bye.
All right.
Thank you.
All
Bye.
right. Okay. We're going to move right back onto the agenda so we can get some things done. We're just going to go right through it. Michelle, you're still online. Do you want to talk about anything about any of the public health issues that are going on or any of the statistics or things you're seeing in the town as a representative of the county? She's still on mute. Okay, we'll come back to Michelle. Anything, Cindy, anything going on with the Waldwick, the Well Baby clinics or anything like that? It's been quiet. And you're on mute as well, Cindy. Cindy looks frozen. Cindy, you're frozen. Anything about the Waldwick Well Baby clinics or no?
No, we have that's two. Can you hear me, Steve?
Yeah, you're kind of freezing and so it's okay. I got it. Not much going on with that. You're frozen. Okay.
Okay, I got something.
Okay, go ahead, Lynn, real quick.
I went to that stigma-free Zoom meeting. And tonight, actually, during our meeting here, Jane Clemente is giving a presentation on the Zoom that's with the Tyler Clemente Foundation. She's giving that now. Also, there was that the Stigma-Free had a virtual 5K run that was April 24th through May to kick off Mental Health Month. I thought that they're an active group. And the Rampo Indian Hills students are creating a scavenger hunt, and that starts tomorrow. And you can go on the Stigma-Free website, Wyckoff Stigma-Free Facebook page, and you'll get your first clue. And then you're going to go, there's one for each town. There's a scavenger hunt for each town, Oakland, Franklin Lakes, and Wyckoff. And they're going to send you to different establishments. And then all of them are going to end up at the schools. So that's going to go on. It sounds really pretty interesting. And you can do it with your families or anything. So that sounds really cool.
Great.
So that kicks off tomorrow. And I'll tell you, the Teen Health 101, that was from Indian Hills. Valerie was a student there. Boy, they're online with a media platform and posting stuff, and most of their stuff comes from the World Health Organization, and they're an active group up there in Indian Hills. It was an interesting meeting.
Great. And that's good mental health. And if they're getting out there doing a scavenger hunt, it's physical health and it's family unity thing. So it's all a good positive experience. And that's a wonderful thing that they're doing.
Yep. So that kicks off tomorrow. If anybody wants to do it, you're welcome to do it.
Okay. Cindy, anything we need to know about food handling? Linda, do you want to just mention anything about what you just heard tonight, or is that definitive?
Sure. Yes, I did text the parade committee is having a meeting as we're having our meeting. So I texted them and asked them about the Pretzel Man or any other food vendors that might want to. And they said, no, please, no food.
Okay.
Okay. Sorry.
Thank you, Lynn.
Yep.
That's okay. Thank you.
Well, you never know. With the news that just came out from the CDC, that changes everything. You never know.
Yeah, but you're only a couple weeks away from the parade anyway, so I think they're probably going to hold true with their position. Yeah.
And there's a lot of towns that aren't even having parades. Franklin Lakes,
Yeah.
Oakland, they're not having even the parade. So for us to go ahead with this parade is like, we're on the forefront here. So if that's
good.
if they don't want food, let's just comply.
Oh, yeah.
Anybody else have anything else in the news, any old business, any new business, anything going on health-wise that we need to talk about before I close out the meeting? Okay, hearing nothing else, I'll entertain a motion to adjourn.
Second.
Motion to adjourn.
All right.
All right, Dr. Yee, and second by Mr. Culinary. Thank you. Listen,
Steve,
Maureen, yes. Go ahead.
Steve, can you hear me, Steve?
Yeah,
Oh, hi, Cindy.
We have to talk about the food handlers licensing. I have a few people who haven't paid.
okay. You want to bring, let's do that right now. We didn't close the meeting out yet, but go ahead. We're in discussion. So go ahead, sure. Is Cindy's screen freezing on us? Is that what's happening?
I'm sorry, I didn't hear that, Steve.
All right. Yes, please go ahead.
So we have two businesses who have not paid their fee, which was actually due December 31st, but I gave them till January 31st. And they are not paying their late fee. I don't know how the board feels about that. I have had 3 businesses who have paid their late fee.
Any discussion around the table?
Well, if they don't pay the late fee, well, then
They don't get their
have to
license.
pay- They don't get their license. I mean, it's simple as that. I mean, that's
Yeah.
the rule. That's the
Cindy,
law.
was the late fee the 50% that it used to be? It used to be the
Yes.
fee plus the 50. So
Yes.
several paid the late fee and the others haven't paid anything at all?
No, they did send checks, but without the late fee, but I haven't processed the money yet.
Personally, I think it's unfair to the people who
Here,
did pay the
some
late
of-
fee.
Some
I
of the
agree.
businesses actually felt that they shouldn't have been charged a fee at all this year because of the pandemic.
Well,
A
they
fee
can,
to serve, they have the license.
So
The
the
license still
options
serves, so.
are,
Cindy, they can feel anything they want to feel. There's policies and procedures in place that the town implements, and we follow the town's policies and procedures. They can't just make their own rules as they go along that they don't want to pay the late fee or anything like that. And I'm certainly sympathetic. We all have dealt with it business-wise with the pandemic, but there are rules in place. They were fully aware of the rules in place. They were granted extra time as well. So I think that probably the best thing maybe is not to give them their license until that late fee is paid. That is unfair to the people who paid a late fee, who followed the rules. Anybody have any consideration about that? All right.
No, I mean, I
agree.
think everything you said there is right on the money. I mean, look, Cindy was gracious enough. We all agreed we're going to give an extra month with plenty of notice, and everyone knew. And the people that did pay the fee now what are we supposed to do? Other businesses have paid the late fee, and we can't just backtrack. We have to follow the rules, and I understand it's a pandemic. It was difficult, but it wasn't like we stopped. The state and the county didn't say that you couldn't open your business to serve food. There was regulations that you couldn't have indoor dining, but you still had to go, and so you had the option to stay open.
Yeah. So, okay. So are you comfortable with that information, Cindy? Okay. All right.
Or
I'm gonna-
sorry, you have to be, Cindy, the one to take the brunt of that, though, but I guess that's
Well,
just,
it comes from the community. It comes from the township. It's
Yeah.
not Cindy. This is the township.
Yeah.
So there's ordinances in place, and that's why they're in place for all of us to follow, and or equally follow it.
that's right.
And that's the way it should be. Okay, before I close the meeting, just one positive thing. Let's leave COVID with a positive. That the state implemented an automatic number change. They removed duplicate case reports. On a one-time drop of 10,442 deaths, the numbers came down. So apparently there's 10,442 people were reported dead twice, it seems. So it's a nice thing, and 11,000 less people. And not to make a joke of it, but it's nice to have less than more. So, okay, without further ado, Maureen, thank you for all the technical work you do, and thank you everybody for our board meeting. We'll see you next month.
Thank you,
Bye,
Doc,
everybody.
for doing a great job. Thank you, Maureen.
Great,
Pleasure.
great
Maureen.
meeting, great information. I listened to the whole thing. It was wonderful. I loved it.
Good. That's what we do for the public.
Does Michelle have anything to talk about?
I asked her before, but she was on mute and she hasn't come off of it.
Michelle? No. Okay.
You know, what we'll pick her up next month. We'll pick up her reports. Okay. Good night, everybody.
Good night.